Now, we just discussed the innermost pelvic floor muscles, which essentially are the levator muscles. External to the levator muscles are the peroneal muscles, which are also part of the pelvic floor muscles, an important part. And starting with a female, the important peroneal muscles are the bulbocavernosus muscle over here, the ischiocavernosus muscle over here, the transverse peroneal muscle located over here, and the anal sphincter muscle. This, in turn, is a view of the male peroneal muscles. And they're not very dissimilar from the female peroneal muscles. This is the bulbocavernosus muscle, and the bulbocavernosus in the male surrounds the proximal urethra, the part of the urinary channel that is very internal, and it actually functions to expel the last few drops of urine by contracting, and also during ejaculation it compresses the urethra, expelling semen via strong spasmodic contractions. And in women, we just saw a moment ago, this muscle was actually divided into halves that extended from the clitoris to the central tendon, and it covers the erectile tissue that is part of the clitoris. In the male, the ischiocavernosus muscle, located over here, has a very important purpose in stabilizing the erect penis, retarding the return of blood, maintaining the erection, and it has the identical role and function in the female, stabilizing the clitoris, retarding the return of blood. Transverse peroneal muscle and anal sphincter. Okay, now that we have a little understanding about the anatomy of the pelvic floor muscles, I would like to discuss the why and the how of doing pelvic floor muscle exercises. First of all, why? Why bother? Pelvic floor muscles are important to prevent or improve urinary incontinence, to prevent or improve pelvic relaxation, and also have a very strong role in aiding sexual function. If you're going to do pelvic floor muscles, you really need to first become aware of the presence of the muscle, the location, and the nature of it. And then exercise it, like you would exercise any muscle, to increase the strength and tone of the pelvic floor. It is very important to know what is not the pelvic floor muscles. The pelvic floor muscles are not the abdominal muscles, they are not the thigh muscles, and they are not the buttock muscles. They are the muscles that go from the pubic bone in front to the tailbone in back in sling-like fashion. A good way of recognizing these muscles for anybody is when you have a full bladder, to start urinating and then to interrupt your urinary stream. If you are able to interrupt your urinary stream fully, then you have command of the pelvic floor muscles. For a female, a finger in the vagina and a squeeze should result in the feeling of tightening on the finger. So that's another nice way of assessing strength of the pelvic floor muscle in a female, just as we do in the office during a pelvic examination. If you do a proper pelvic floor muscle contraction, you should get the feeling of your seat, the area where you sit, moving in an inward and upward direction. And it is essentially the opposite feeling of bearing down to move your bowels. It's essentially bearing up. Another helpful image is to picture your pubic bone in front and the coccyx in back and the pubococcygeus muscle that goes in between. And the goal is to try to move the pubic bone and the coccyx bone towards each other. Another helpful image is thinking of the pelvic floor muscles as an elevator, and when you engage these muscles properly, the elevator rises to the first floor from the ground floor, and with continued training, the goal is to get to the second floor and then release very slowly. It's important to assess your pelvic floor muscle strength. So what I suggest, once you have the idea of what the pelvic floor muscles are, time in seconds, how long you can contract the muscle, and record that. And also perform as many contractions as you can with a few second break between each contraction until you achieve fatigue, and record the number of repetitions that you're able to do. And essentially the goal is to increase the strength of these muscles, increase the length of time that you can contract these muscles, and increase the number of repetitions performed. The pelvic floor muscles can be exercised anywhere, at any time, can be done lying down, it can be done sitting, it can be done standing. I usually recommend to my patients that they use downtime to do pelvic floor muscles. That is, waiting at a long red light, or standing in the checkout section of the supermarket, or watching television, commercial at night perhaps. My recommendation is for 3 sets per day minimum, with a goal of working your way up to 25 repetitions with a 5-second contraction and a 5-second relaxation. And that's really not so easy to do at first. First, you'll only be able to do short bursts of contractions. And as with any strength training regimen that you do, whether it's for your chest muscles or back muscles, abdominal muscles, you can expect some soreness as the target muscles will be overloaded. And I would say that it will take at least 6 to 12 weeks before you realistically can expect some improvement in terms of whatever symptoms you're having. And use it or lose it is very valid here. If you don't continue to use the muscles and exercise them, you will lose some of the strength and tone that you have achieved. Now, it's very important for somebody, for example, who has incontinence to recognize the specific triggers that induce the incontinence. It might be something like sneezing or coughing or standing up from a sitting position. Sometimes it is putting the key in the door to your home, or turning on the faucet, or exposure to a cold blast of air when you open the freezer. There are many potential triggers for different kinds of incontinence. If you recognize clearly what the triggers are, then a very excellent means of mitigating the incontinence is simply to do a rhythmic pelvic floor muscle contraction before or at the time of the exposure to the trigger. So for example, if standing up tends to induce incontinence for me, then I would want to do a few good vigorous rhythmic contractions of the pelvic floor prior to standing up. And what that might just do is inhibit an abnormal bladder contraction from occurring and stop, that is, prevent the incontinence from occurring. If I have a condition called stress incontinence, in which there's leakage with sneezing and coughing, laughing, exercising, then you would basically want to try to squeeze the pelvic floors rhythmically at the time of those specific triggers. So in conclusion, the pelvic floor muscles, both the levator muscles on the inside aspect and the peroneal muscles on the outside aspect, are a very important muscle to human beings, a very important component of the core muscles. If you achieve fitness of your pelvic floor, it will help you on many different levels. It's very helpful in a woman who is pregnant prior to having a child, or postpartum for a woman suffering from incontinence. It is helpful for men prior to undergoing radical prostatectomy, as well as for men after radical prostatectomy who are suffering from urinary incontinence. It is extremely helpful for urgency incontinence, which is the sudden urge to urinate, the inability to get to the toilet on time, and it's extremely helpful for stress incontinence, which is leakage with sneezing and coughing and exertion. It can help mild degrees of pelvic relaxation. It can help sexual dysfunction. So on many levels, it makes so much sense to have a fit pelvic floor, just as it does to have a fit cardiovascular system and a fit musculoskeletal system in general.